Welcome to Pediatric Endocrine. This is going to be a three-series of videos. I'm going to start with just an endocrine overview, and then the second video will go into pediatric disorders involving the pituitary, and then I'll finish it with a video on metabolic disorders. So we're going to start with our general endocrine system overview, talking about some of the key components in the endocrine system. We know that the endocrine system has 5 general functions, and that's to support fetal development, our growth, our ability to reproduce, our body's ability to maintain homeostasis, and to adapt. So we're going to start with some of our key components. The hypothalamus, which is located at the base of the brain. This is our control center of the endocrine system. It synthesizes, releasing, and inhibiting hormones. So we have the production of ADH and oxytocin. Both of those are then stored in the posterior pituitary. It coordinates endocrine system with the autonomic nervous system and responds to the input from the central nervous system, the brainstem, the limbic system, and the cerebral cortex. And then we have our pituitary gland, which is connected to the hypothalamus via a pituitary stalk. We have our anterior pituitary, which is about 80% of the gland, and it receives releasing and inhibiting hormones via the portal blood vessel. It secretes 6 major hormones, including our tropic hormones. So we have TSH, ACTH, FSH, LH, growth hormone, and prolactin. Our pituitary stores and releases ADH and oxytocin, and it's connected to the hypothalamus via the nerve tract. Our regulatory system. So the basic concept is the feedback, and it's a negative feedback, and it's the most common with our endocrine regulation. It works like a thermostat. When the hormone levels reach a certain point, the system automatically shuts down and slows the production to maintain the balance. So how it works, we get a stimulus trigger hormone release from a gland. The hormone travels through the blood to target cells. Target cells respond and produce an effect. Rising hormone levels are then detected. This feedback signal inhibits further hormone release. Production slows or stops until the level drops again. An example of the negative feedback loop would be like in our thyroid. So the hypothalamus releases thyrotropin releasing hormone, TRH. TRH stimulates the anterior pituitary to release TSH. TSH stimulates the thyroid gland to produce thyroid hormones. Rising thyroid hormone levels inhibit TRH and TSH release. And then system returns to balance. Why the negative feedback matters? Well, it maintains homeostasis. So it prevents excess hormone production. It keeps hormone levels within that narrow, healthy range that we need, and it allows the body to respond to change needs. Their clinical significance: if we have a disrupted feedback, we're going to have pathological hormone production. So, too much will be a suppression and we'll have a hormone deficiency. Too little feedback, we have hormone excess. So, understanding the feedbacks helps with diagnosis of our endocrine disorders. When we talk about tropic hormones, these control the secretion of hormones by other glands, creating cascading regulatory effect throughout the body. Integration. The hypothalamic pituitary system functions as the central regulatory hub, integrating nervous system input with hormonal control to maintain homeostasis, coordinate complex behaviors, and respond to environmental changes. So, how endocrine is different in children versus adults. We're going to start with the growth and development. So, with children, Active growth and development process is occurring, sequential growth patterns during childhood and adolescence. Hormones are critical for physical maturation to develop. Differentiation of reproductive and central nervous system is ongoing. Growth hormone is essential for bone lengthening and muscle development. And sexual maturation during puberty is completely hormone dependent. With adults, we already have the growth plates closed, so the focus then shifts on maintenance of those bone. Hormone maintain optimal integral environment and reproductive systems fully developed and coordinated. When we talk about hormone production and function, with children, higher growth hormone levels are needed for development. Thyroid hormones are critical for brain development and growth. Sex hormones gradually increase during puberty. Insulin requirements change with growth spurts. More sensitivity to hormone imbalances because they're going to affect their development. With adults, we have stable hormone levels for homeostasis. We get a gradual decline in many hormones as we age. Growth hormone decreases, leading to loss of muscle and bone mass. Estrogen declines, and we have menopause, which then can affect our calcium preserving and our bone density. And then also, we get changes in our immune function, which increases our risk for both infection and cancer. So, the clinical considerations in children, endocrine disorders may cause delayed or early onset of puberty, which early onset of puberty is that precocious puberty. We can have failure to grow, or we can get excessive growth. We can get cognitive developmental delays. We can get long term effects that will inhibit them achieving full adult height and function. And treating for them is really critical for optimal outcomes. So we need to identify and intervene quickly. With adults, the focus is usually on more metabolic disorders and reproductive concerns and age related hormone decline. Adults are more likely to have long term chronic diseases and high risk of cancers. Now, yes, children can get development of diseases that will become chronic, but with the pediatric assessment differences, pediatrics needs to be very specific. We need to be using their growth charts and plotting them accordingly. We need to be assessing to make sure that they're meeting their developmental milestones. We want to assess them using the Tanner stages to check for sexual maturation. Tanner stages are 1 to 5, 5's adult, 1's pre-puberty, and we'll talk about that more when we get into the next video where we discuss precocious puberty. We can do x-rays of their risks for bone aging studies and assessing their school performance and their behavioral changes. And that is going to be the end of this video.